Today, we're digging into a really fascinating new research paper that uncovers this powerful, kind of unexpected link between public health insurance and public safety. So let's get into the data and see exactly how they figured this all out.
I mean, it sounds almost too simple to be true, doesn't it? The whole question this study asks is whether something that seems totally unrelated, like Medicaid coverage for psychological treatment, could actually prevent crime. We're going to unpack exactly how these researchers tackled this pretty wild question.
Now, this idea isn't coming completely out of left field. We've known for a while that certain very specific mental health programs can be super effective. But this study, well, it asks something much bigger and way more complicated.
So on one side, you've got these targeted programs. You can think of them like a surgical tool, right? They're focused, they're controlled experiments, giving therapy like CBT to very specific at-risk groups. And we know they work. But a broad policy change, that is a whole different beast. You're not targeting anyone, you're just making treatment available. And that leaves these huge questions. Would the people who could benefit the most actually go seek out this help on their own? And could something like this possibly work at the massive scale of an entire state? That was the big mystery.
So, to answer a question that big, the researchers didn't actually have to design a brand new experiment from scratch. It turns out they found one that was already happening out in the real world, all thanks to a handful of state-level policy changes.
So check this out. Between 2004 and 2010, these 5 states all decided on their own to expand their Medicaid programs to cover psychological treatment for adults. Now, they weren't trying to reduce crime. This was purely a healthcare decision. But in doing so, they accidentally created the perfect natural experiment for researchers to come in and study the effects.
Okay, so this is where it gets really tricky. Just because crime went down after a policy was introduced doesn't mean the policy caused it to go down. Correlation isn't causation. The researchers had to somehow prove the link.
I mean, think about it for a second. Crime rates can be affected by pretty much anything. The economy, new policing strategies, population shifts, you name it. So how on earth do you filter out all that noise and isolate the impact of this one specific change to Medicaid coverage?
Well, they used this really clever method called a within-state comparison. The basic idea here is that the poverty rate in an area is a really strong proxy, a stand-in basically, for how many people there are eligible for Medicaid. So by comparing different areas inside the same state, they could control for all those other big statewide factors.
And here's the really brilliant part of the logic. In high poverty areas, you've got way more people who are eligible for Medicaid, so the policy should have a much bigger impact there, right? Meanwhile, low poverty areas with fewer eligible folks act as the perfect comparison group. So by tracking the difference in crime trends between these two types of areas before and after the policy, you can really nail down its true effect.
So, after all this really careful setup, what did the data actually say? Did making psychological treatment easier to get really lead to a drop in crime? Let's take a look at the results.
And the answer is a resounding yes. It's pretty amazing. The study found that expanding Medicaid coverage for this kind of treatment led to a 7.8% reduction in the overall index crime rate. I mean, that is a really substantial impact coming from a healthcare policy. But, the details matter. So where exactly did this drop come from? Well, the data shows a really crucial distinction. This whole effect was driven almost entirely by a big drop in property crimes, things like burglary and theft. The impact on violent crime, on the other hand, was much smaller, and it wasn't statistically significant, which basically means we can't be sure that little dip wasn't just random noise. And here are the specific numbers right from the study's main table. You can see what they call the average treatment effect, or ATE. It was a reduction of about 5 index crimes for every 1,000 people. And look at that. Almost all of it, 4.8 of those 5 crimes, came directly from property crime. But, the story doesn't just end with crime stats. The researchers also needed to find some evidence that the policy was actually working the way they thought it was. That it was actually getting more people into treatment. And boy, did they find it. In the areas that were most affected by this Medicaid expansion, there was a nearly 1/3 increase in jobs in psychology-related industries. That is a massive, massive response from the supply side. And this is so crucial. This huge jump in jobs is basically the smoking gun. It's powerful proof of the whole chain of events. More people got coverage, which created more demand for services, and then the market responded by creating more jobs to supply that care. The whole system actually worked. So what about the cost of all this? This is incredible.
The study's author calculates that the money saved just from the property crimes that were prevented was worth more than 10% of the entire cost of the adult Medicaid program during that time. In other words, the crime-fighting benefits alone might have been big enough to pay for the psychological treatment coverage itself.
So after looking at all this data, all these clever methods, what are the big takeaways? Let's just break it down one last time.
So what have we really learned here? Well, first, just providing broad access to mental health care can be a seriously powerful crime prevention tool. And what's amazing is that it didn't require any special targeting of high-risk people. The policy just plain worked by boosting both the demand for care and the supply of providers, which led to that big drop in property crime. And maybe most surprisingly, the economic benefits from that crime reduction alone were huge, a major offset to the program's cost. And that really leaves us with this final, fascinating question, doesn't it? This study shows that a solution to a public safety problem might actually be found in our healthcare system. It just makes you wonder, what other powerful, game-changing solutions are sitting right there in front of us, in places we'd never even think to look?